Presbyopia is a completely natural age-related change in the eye, and it relates to the lens of the eye. So we're born with this beautiful crystal clear lens that acts as a liquid gel and can change shape and therefore can change focus. So if we've got a healthy, normal eye, we will be able to see at far distance, and then we look at something that approaches us, we can follow it all the way on to the tip of our nose and back out again, and that incredible ability is through the ability of the lens inside our eye to change shape. Now that lens is made of protein. It's about 60% protein. It's one of the highest concentrations of protein in the body and water, and that allows it this tremendous flexibility. Sadly, it doesn't last forever. So as we go through life, those proteins change in structure. We can still see through them. The lens retains its transparency and clarity, but now the lens starts running out of flexibility. And so typically in our mid to late 40s or even early 40s, we find that we can't make that focusing effort for close objects. We can still see clearly at distance, but now we have to start pushing things a little bit further away from us. So that's when we start finding our arms aren't long enough to read our Kindle or our phone or iPad, and that is presbyopia. Presbyopia, of course, can go along with other refractive changes of the eye. So you can be short-sighted, myopic, or long-sighted, hyperopic, or have astigmatism, and all of those can coexist with presbyopia. But presbyopia is the natural change in flexibility of the lens, and therefore it's going to catch up with everyone sooner or later. Often people ask, can I slow down presbyopia? What if I stop wearing reading glasses, or what if I wear reading glasses more? Because that's the first step in the treatment of presbyopia. Most people start off using ready readers, over-the-counter, magnifying glasses, and that helps them with their close vision. The jury's probably out on this. I think that in most cases, what most people find is that once they've started to use reading glasses, their vision is just so much more comfortable for reading that they don't like the struggle of not wearing reading glasses. So I think you can't really slow down presbyopia. It's the passage of time, but you can choose whether you wear readers or not when you start to struggle with presbyopia. You can't damage your eyes by wearing or not wearing glasses if they're healthy. So if you are presbyopic and you are struggling to read and you don't wear your reading glasses and you do your best to read without them, you will not harm your eyes. You may get headaches, you may find it that you are losing the enjoyment of reading, but you won't physically damage your eyes. Typical symptoms of presbyopia are just that. As time passes, you find that you're struggling to see small objects. So reading a book, looking at your watch, reading a Kindle, looking at instructions, items in the supermarket or prices, all of these things become a struggle. And these are all things that is telling you typically in your early 40s that you're becoming presbyopic and that time is not on your side in this regard. We confirm presbyopia in an eye exam, or we measure presbyopia simply by measuring the spectacle correction for distance and measuring the spectacle correction for near. There are additional tests, so we can measure the ability to focus or accommodate. So there are optical devices that can measure accommodative range, but usually we just measure the reading vision, and then as we add spectacle lenses, we can then calculate and measure the amount of presbyopia and the amount of near vision that is required to see clearly. Presbyopia can be confused with other refractive errors because if you are short-sighted, then your eyes naturally focus close up. So if you were short-sighted and you had a spectacle correction of -3, that would mean that without corrective lenses, your eyes would focus naturally at 33 centimeters. That would be your far distant point. Now, if you didn't wear your spectacles or your contact lenses and you held a book at 33 centimeters, you would be able to read it. So although you are presbyopic and myopic, you could still read at 33 centimeters without correction. But if you move the book closer towards you, you would then lose focus because your presbyopia would kick in. So there are many ways of correcting presbyopia optically or surgically. Optically, the most frequent correction is with spectacles, and spectacles that can be worn all the time usually fall into the category of bifocal spectacles or varifocal spectacles. Varifocals are the most commonly used, so these allow you to see clearly at distance and then as you look down through the lens to see clearly up close. The advantage of varifocal spectacles is that you can see into the distance and you can read without taking your spectacles on and off. But the disadvantage of varifocals is both one of magnification, so as you increase the spectacle power to read through a pair of varifocals, as you look down, objects become bigger and therefore they look closer to you. So often people who have hyperopic prescriptions, for example, who wear varifocal spectacles, find that when they walk downstairs, they find actually that their footing is not so secure because they can't really judge the distances of steps and objects underneath their feet. Although varifocals optically can be brilliant, they can cause problems with clarity of vision. Other methods of correcting presbyopia include contact lenses. So contact lenses again can be used to correct other refractive errors, short-sightedness, far-sightedness, as well as presbyopia. So there are multifocal contact lenses. Again, these can provide excellent vision, but they too can have their drawbacks. So typically, when we see people who are unhappy with multifocal contact lenses, they find they just can't get the clarity of vision or the stability of vision that they do with other modalities. We see a lot of people who have presbyopia for surgical correction, and the most frequent surgical procedure that we perform for this is a laser vision correction procedure called LASIK PRESBYOND. Presbyopia and being that lack of focus, and beyond, presbyond being the way to correct that. And that is a form of laser vision correction that blends vision from distance through to near, so it allows you a more natural range of vision from far distance to close up, but crucially without having to move your head. So that range of vision is present in your line of sight. So wherever you are looking, down, up, left or right, you are able to gain a range of vision. If laser vision correction isn't suitable for you, or for example, if you have changes, physical changes in the lens of the eye, cataract, then we can address presbyopia through cataract surgery or lens exchange surgery. And we have many different types of lenses that we use in cataract surgery to increase the range of vision, ranging from multifocal lenses through to extended monovision lenses, through to extended depth of field lenses. So lots of different types of lenses, and we tailor those lenses very specifically to the type of vision that a given individual would like to have. So brilliant options for treating presbyopia surgically, ranging from laser vision correction, usually in early presbyopia, through to lens exchange procedures or cataract surgery in later presbyopia. In general, eye exercises don't really help in presbyopia because it's a physical change in the lens of the eye. So what we find is that eye exercises can be used very early in life for eye movement disorders, but when we are dealing with age-related changes in the lens of the eye, natural onset presbyopia, it really has to be an optical correction, either spectacles, contact lenses, or surgery in the form of laser or lens exchange surgery.